I'm just trying to understand the differences between severe cognitive damage or problems to mild. What does that mean, and what are the different? If it's severe, is there something beyond even worse than severe damage? Is there mild? Is it something better than mild?
Hmm.
What's the limit on that?
So it sounds like you're asking about basically like diagnostic labels or maybe
Yeah.
classification of a level of impairment.
Yes.
Yeah. So there's actually so this is one of the things that I think neuropsychology as a field is working on and hasn't perfected yet. Um, so this is a two-part answer. So we have the DSM-5 text revision now. This is the most updated version of the Diagnostic and Statistical Manual, sort of our reference for diagnostic criteria. And when it comes to cognitive functioning and cognitive impairment, we have two diagnostic labels. One is uh, uh, mild neurocognitive disorder, and the other is major neurocognitive disorder. And then we sort of make a comment about what's the cause of, right? So due to brain tumor, due to Alzheimer's disease, due to possible Alzheimer's disease, whatever that is. So that's kind of our taxonomy, so to speak, is mild and major. Um, the diagnostic criteria essentially break down into what is the degree or the extent of cognitive impairment and what is the extent of impairment in activities of daily living. So can someone still drive? Can someone still work? Can someone still manage their money? Can someone still manage their medications? Can someone still make their own food? Use the bathroom, get themselves dressed, those kind of things. So those are the functional tasks. There's a little bit of subjectivity, little room for interpretation even in the DSM, the categories. Um, for example, for mild cognitive impairment, the threshold is a modest decline, but that also could be a subjective decline. So if someone feels like their cognition has declined, um, that would theoretically meet criteria. If someone meets criteria for a major neurocognitive disorder, then that substantial is the word in the DSM. So a substantial decline in cognitive functioning, and then there's some specifics about how many domains need to be uh, demonstrate a decline. And then also that there is at least some decline in daily functioning that requires that person to get assistance from someone else. Um, so there's a little bit more, there's maybe slightly more nuance to it than that in the actual wording. But those are kind of the components of what those diagnostic labels mean. It's, cognition and cognitive performance level, and then functional ability. So activities of daily living performance level. So
So
that's one. Oh, I'm sorry. Go ahead.
yeah, so in your experience, have people ever gone from major to mild?
Yeah. So
Yeah.
okay, and so this kind of will touch on the other part of your question. So um to so the older term that is still in common use but not as uh favorable for various reasons. For the older term for major neurocognitive disorder is dementia. Um, Dementia, again, from a diagnostic label perspective, same thing: decline in cognition, decline in functioning. But dementia kind of has a connotation that things will continue to get worse and progress over time. Major neurocognitive disorder just means this is what it is right now. due to whatever the cause or the suspected explanation is. So someone could absolutely, uh, by uh, by virtue of either cognitive rehabilitation or um, just spontaneous neurological recovery, as brain tissue heals, its functioning can improve. So yeah, so absolutely, somebody could meet criteria for a major neurocognitive disorder at one time point and then no longer meet criteria at a later time point. So that's absolutely possible. A quick aside, just to answer the second part of your question, in terms of like what constitutes mild, moderate, or severe impairment, that's something that varies quite a lot between neuropsychologists. So there are not set guidelines for what level of impairment means, mild or moderate or severe. Um, just as a you know example for myself, I have kind of stopped using those labels because they're not particularly helpful. Um, but if something is a clear decline from what I estimate to be someone's normal level of ability, then I'll call it an impairment. But to say whether it's mild or severe may or may not be helpful. So that's for me, I think, a sort of a case by case decision. But that's a great question, just in terms of what do the labels mean, and can cognition change over time, and can it improve? And it can. It just depends on the cause of the decline. With something like a tumor or cancer that is treated, then yes, it can. Um, and Potentially, with something like Alzheimer's or some of the other what we call neurodegenerative conditions, um, then perhaps not, unfortunately.
So this is probably another reason why you want to stay with the exact same neuropsychologist that you talked to in the past, so so you have the same kind of stain, that's
Yeah, kind of
exact.
yeah, like this, using the same lingo as
Yeah,
kind of.
yes.
Yeah, I mean, I would say that's a potential benefit, in terms of the descriptives and that. I wouldn't say, I think that if you were to if you were to see a different neuropsychologist who was making a direct comparison of tests or cognitive domains, I think they could still put it into context for you and say, well, um, this was described as a severe impairment before. Um, here's the here's the degree of improvement that we've seen. So I think that would be a way to still be able to make that comparison, even if it's a different provider using maybe different terminology.
Thank you very much.
I also just wanted to make a note that you mentioned like activities of daily living. And so long-term care is based on activities of daily living, whereas disability or SSDI, they don't all use the same measurements to determine whether, I guess, you qualify as all. I just wanted to point that
Yeah,
out.
yeah, that's definitely another thing that is confusing. They kind of have different systems for labeling. Yeah.